Hi, this is Anne Cullen. Welcome to another Teachable Moment. Today, I want to talk to you about breastfeeding, and in particular about a baby who's fussy at the breast. And really, I'm talking about in the first few months here. So I want to go over a few things that can cause problems and recognizing that this is a general video. And if you're concerned and have a fussy baby, please get help as early as possible. I, as a lactation consultant, often have clients who come in after weeks of issues, and it's much, much easier to help you and support you and your baby if we can help you in the very early days as soon as there's problems. And a lot of times I think people are hoping things resolve and they don't. So don't delay getting help. Get the support that you need when you need it so that things can go smoothly. The first thing I think is happening a lot of times when there's fussing at the breast is positioning. So I won't go into details about positioning, but what I want to talk about just briefly is that it often can help if you get yourself first really comfortable. And often that means laying back, getting your arms and your back supported. And it doesn't mean laying back very far, but laying back a little bit, letting the breast fall to its natural place, and then adjusting where you have baby compared to where your body is. And it's going to be different for every mom and baby pair, depending on the two of you. And then we want baby really, really turned and most of baby's weight just supported on mom. And that means chest, tummy, hips all turned into mom. And this gives baby lots of good support and helps baby be more comfortable. It also helps you. So the first thing I want you to consider if you've got a fussy baby is how you're sitting, how you're holding. Does baby seem supported? A lot of times laying baby on their side, if they're turned out too far away from mom's body, all kinds of things can be happening with positioning. So we first want to look at that. Next, one of the things I see a lot and that mums report is a baby who is reacting to the flow of milk. So it can be one of two things, of course. It can be slow flow and baby waiting for that next letdown, waiting for that milk to come out. It might be low supply, but it might just be that you're in between letdowns and babies being impatient because they're quite hungry and they want the milk. The other might be just the opposite, where you've got a very fast flow, that letdown comes, baby's quite young, and they're having trouble coping when the flow comes out a bit more quickly. So I want to go back here to talk again about the positioning. And if we get babies in really great positions with their mothers, then they're more likely to be able to cope with the flow of the milk. So, those kind of can go hand in hand. The other thing that can happen is a baby who wants to just drift off to sleep. They're not that interested in their milk, but another letdown happens and they just might not have wanted to feed in that instant. So, and I also think that babies who are being both breast and bottle fed can end up being more fussy about the flow because, of course, when they're sucking on a bottle, the milk just comes out constantly and the breast is different. So that can affect things there. Another thing that I find quite interesting is, and this is probably the most common in those very, very early weeks, is not knowing if baby actually wants to feed, if they're done feeding. So it's kind of misreading their cues. And of course, this is going to happen. Baby can't talk to us. We're just getting to learn. And it's kind of a dance between mom and baby. So I often see a mum who's saying, oh, see, I can't get comfortable. I can't get him to feed. He's squirming around and he's fussy. And I suggest maybe I hold the baby, or maybe we go outside, or maybe we just get up and walk around or lay the baby down. And guess what? Baby's fine and either drifts off to sleep or just happily lays awake. So sometimes remember that if you're thinking, gosh, baby should be feeding, should be hungry, what's going on here? Sometimes just stepping back, taking a break, trying something else that is not feeding related can actually work. And remembering we want to keep the feeding time as a happy, relaxed time for everybody. So pressuring yourself or pressuring baby to feed, really doesn't happen. So I often say, try for a very short time. Certainly if baby's actually crying, we want to get up and do something else. But if there's too much fussing going on and this is feeling like it's not going to work right now, just try something else and see if that'll work. Another thing, of course, we have to consider is baby unwell, or are they in pain? Congestion, especially in a young baby, can really be a problem. So if baby's got a blocked nose, of course they're going to probably be more fussy at the breast. It's a little bit harder to feed then. It could be teething pain, it could be ear troubles. There's all kinds of things that can be going on. So you might want to consider taking baby off to the doctor just to get a check, see if there's anything suspect happening, or have a good look in their little mouth and things like that. So of course it could be that baby's unwell or in pain. One of the things to point out there as well, something that might be harder to put a finger on and harder to see, is what was the birth experience like. So this could be a forceps delivery or even just a cesarean. It could be a fast birth, a baby that was in a funny position in utero. So there could be some pain going on that's harder to get a finger on. So that might be something to get some outside support for. We also have to remember that one of the causes of fussiness can just be distraction, development, or something often termed growth spurts. So just different things happening that we can't really see from the outside, but this is more likely if you've noticed a sudden change and things were kind of going along well, and all of a sudden for a couple of days you just have this fussy baby at the breast, and maybe at other times. That's very likely to just be a growth spurt or a progression in development, distractibility, something going on there, and probably it will pass. So if it's just a couple of days, and that could be something that's just going to change and go through. We need to look at the time of day that things are happening. So one of the most common times for babies to be fussy at the breast is kind of, I think, around 4 p.m. or later. Some people call it the witching hour, but it generally seems to be when we want to sit down to eat our evening meal, doesn't it? Baby gets really, really fussy. So some of that is that, in the morning, feeds can be really easy. We've just slept, maybe, but your milk seems to be more plentiful earlier in the day. It seems to be a little bit slower later in the day. For whatever reason, babies can be a little bit more fussy at that time, and it can be really, really frustrating. And that seems to be from about the 3 to 12 week mark. So that's something to consider. Is baby actually feeding all right at other times of day, and it's just this one window? So we could look at things like milk supply. Are there oversupply issues, undersupply issues? What are babies' weight gains like? If you might end up having a fussy baby because those weight gains are really high, like, a pound a week or 300 grams a week. And, really we'd like it a little bit less than that. I like to see around 200 grams. Babies can be really fussy if they're gaining a lot less than that. If you're very small weight gains, those babies can tend to be fussy and sleepy. But also babies that are gaining lots of weight can be really, really fussy because their bellies are probably getting a little bit fuller than they'd like. So another thing to consider is what Dr. Pamela Douglas talks about, keeping the dial turned down. So we all want our nervous systems to be working. And for babies, we want to be in that nice rest and digest kind of, everything's flowing, everything's relaxed, baby's getting fed well, and we're responding to our baby. So this is a key, is looking at, and this would be in particular, I think, for the baby who's not maybe just fussy at the breast, but fussy at other periods of the day, and you're just really kind of struggling. You have a baby that cries a lot and you're not quite getting the handle on what's going on. So are you responding to your baby the best you can most of the time? Or are you watching the clock? Are you thinking too much about the books you've been reading and what you've been hearing? Do you find yourself saying should a lot, like, he should be able to go longer in between feeds, or he should be able to lay down and not need me, or I should be able to put him down more. If you're finding those kinds of things, or you're thinking, no, certainly he can't be hungry yet, he just had a feed, and then you try to distract and put off a feed, this is when that little baby dial can get turned up. And babies don't regulate very well themselves, and especially this can come down to personality a little bit. Certainly if you've got a more sensitive baby just with that inborn personality, that dial can get turned up quite quickly. So thinking about, am I putting off feeds? Am I not responding to my baby as well as I could? Is there something I could do to adjust that? So just overall, looking at patterns. What is the pattern of this fussiness? Is this in the middle of a feed when the milk has slowed down and my baby's waiting for another letdown? Or is it every time a letdown happens and that's when the fussiness happens and they pull off and then milk sprays in their face? Is it just that cluster feeding time later in the evening? You know, let's really look through and find patterns. And if you need to write things down or pop some notes in your phone to kind of keep track for a few days so you can kind of see if there's a pattern. So maybe there is and maybe there isn't. That's really helpful to know and get to the bottom of what's going on. And one of the other things you can look for then is baby feeding okay on one side but not the other? And sometimes I think that can be an inconsistent supply. It is possible that you have, say, better flow and supply on your right side than on your left. So baby might be more comfortable on one side feeding than the other. They like the slower flow or they like the faster flow. But it can also be an indication that maybe, again, in that difficult birth, baby's uncomfortable. There might be some, you know, if you had a forceps delivery or that quick delivery or something that's happened, and then you notice baby's fussing at the breast, but in particular maybe on one side, that could be some pain going on or some discomfort from that. So it's always good to look at that. And I would also suggest that if you are bottle feeding and breastfeeding, that could cause some fussiness at the breast. So are babies fussing at the breast and not at the bottle? Is it fussy at both? You know, kind of what's going on there. I also want you to look at other symptoms. So if your baby is fussing at the breast and they have rashes or eczema, really explosive poos that go all the way up their back, and that's kind of the norm, lots of crying, you know, what else is going on that might indicate a problem? And in that case, if there's lots of different symptoms like that, that's time to get some medical checks, get some health professionals in to help get to the bottom. There might be allergies, especially if you yourself or baby's dad has allergies. There might be allergies. It is pretty uncommon. We probably put a little more emphasis on that for most babies than we need to, but you know, just make sure that that's always a consideration, not just if there's some fussing at the breast, but if it's fussing at the breast and some of these other symptoms as well. And also just, you know, looking at the whole picture of your baby, how unsettled are they? And, you know, but really what we need to understand again is those realistic expectations of what should a baby be like. And of course, babies are sometimes going to fuss, they're sometimes going to cry, but it is normal for babies to want to be held all the time, to be sleeping on a human being or close to a human being and all that kind of thing. So there's lots of things to consider. And again, like I said at the beginning of the video, if you're struggling, get help sooner rather than later. It really pays to get on top of your problems. Make sure things, you know, can be tweaked or not tweaked. It's a health concern or whatever it is, but just get help straight away and make sure everything can be as good as it possibly can. Thanks so much for watching. Bye.